Hello, this is Dr. Kannan. I finished my MBBS in Thanjavur Medical College and I finished my radio diagnosis in PSG and I finished my fellowships in cardiothoracic radiology and pediatrics. Um, Now this portion of lecture we will see pediatric chest abnormalities. Okay. So there are few questions will come in the pediatric chest. So I will give some basics idea about the pediatric chest abnormalities. So basic, what is the X-ray? So if you produce the X-ray, it will pass through the object. Depend upon the object's characterize, it will change. See example, if you take air, it won't block as much X-rays as metal. So here more X-rays passing, so air appear more black on radiograph. Here it block more metal, blocks some more X-ray radiation, so it appear white. This is the basic. You just pass the X-rays through the object. Depending upon the object, it will change. The X-rays can absorb, deviate. So there can be so many changes will happen. But just radiograph, we are seeing black and white. Why black? If it is air, more X-rays are passing, it appear black. If bone, it stop more X-rays, so it appears white. Soft tissue, it will come in between, it will appear somewhat white. Fat, grey. This is the basic. Another one basic, AP radiograph or PA radiograph. Most common is PA radiograph. Why PA? X-rays going posterior to anterior, AP anterior to posterior. If it is a sick child, neonate, trauma patients, we do AP. Otherwise, most common procedure is PA radiograph. One thing, see here AP, the heart will be here in the more anterior side. So if it goes, it takes some more distance to pass the X-rays, so it will give apparent magnification, apparent cardiomegaly. That is why cardiomegaly we should comment on PA radiograph. When you comment cardiomegaly in AP, you should be very conscious. If it is massive, no issues, but you should aware AP radiograph can produce apparent cardiomegaly. How to differentiate? It is a PA or AP view. Here if it is PA, we usually do in the standing position. So that time we the patient in the standing position and the hand should be above the cassette. So automatically the scapula going outside the lung field. So the PA radiograph, scapula away from the lung field. The posterior ribs are distinctly displaced. AP just opposite. It is scapula will be in the over the lung field, anterior ribs are indistinct, and the heart relatively apparent cardiomegaly will be there. So clavicle in the PA view, it will be appear over the lung field because of this position. But AP patient in the supine position, the clavicle it is not that much in the lung field. Another term, radio opaque or radiolucent. I will tell you, radiolucency or transradiancy means black, that is the X-rays. The most X-rays actually passing through that produce that darkness. Example, air, radio opaque, white, bone, metal, consolidations, that is white. So, radiograph black and white. Coming to another one basic concept, why this black happening in this X-rays? Why the black? I already told air produce the black. So, if more air, it will be more black. So, which conditions produce the more black, more air? It can be due to pneumothorax, bulla, emphysema. Any conditions produce increased air, that lung field appear more black. If the lung receive less blood, it will appear more black. If it has less mass, muscle mass, like mastectomy, absent pectoralis major, Bolen syndrome, it will appear black. So, black, three things: air should increase, blood decreased, muscle decrease. So, in this unilateral hyperlucent hemithorax in children, this is most commonest MCQ.